Hi, I'm Dr. Messina. Today, patients looking for a botulinum toxin procedure have three choices: Botox, Dysport, and Xeomin. Of the three, Botox and Dysport are the two major players. So, which should we use? What are the similarities and what are the differences? We're going to find out today. First of all, Botox and Dysport have been used since the late 80s, early 90s for spasticity of muscle groups. Dysport treated dystonic reactions, therefore the name Dysport. However, today they're used to relax a much smaller group of muscles, giving a cosmetic result as opposed to the medical result that they were initially intended for. Both of them work by blocking a substance going from one nerve to another. The first nerve releases the substance called acetylcholine. It crosses the little synapse or space between the nerves. The second nerve, being attached to a muscle, fires off, stimulates that muscle to contract, and that contraction of the muscle causes a little wrinkling on the skin. So the way both of these medications work is they prevent the passage of that acetylcholine, therefore the second nerve can't fire and the muscle can't contract and it lies there flaccid. People mistake these drugs for muscle relaxants. They're technically not. And they also say, oh, it's a neurotoxin. It is not a neurotoxin. Neither of them are toxic to the nerve. They prevent the acetylcholine from getting across. They don't damage the nerve itself. That's a very, very popular misconception. They're both in the botulinum toxin family, so they're basically, for an easier term, cousins to each other. One major difference is Dysport is a smaller molecule. Being a smaller molecule, we have to give a little bit more in a dosage of units compared to Botox. So 1 unit of Botox equals 3 units of Dysport. Being a smaller molecule, though, has some advantages. Dysport seems to work a little sooner. Usually a patient that I give Dysport to senses something changed in about 3 days, a significant blockade in 6 days, and full blockade in 14 days. And it should last for a minimum of 3.5 months. Botox, on the other hand, takes a little longer to kick in. And again, it should last for 3.5 months. However, a lot of patients, and me included, feel that the Dysport tends to last maybe 2 weeks longer and seems to give a more even outcome, especially on the forehead. That might be because Dysport, being a smaller molecule, spreads a little further than Botox. It also is the reason why when you're injecting Dysport, you have to be very careful of your anatomy because it is going to spread a little bit more than Botox. They both have the same properties. If you're allergic to either of them, if you have had an allergy to either of them, egg allergies, or if you've had neurological problems, then neither of them are for you. Very common side effects of both of them as well would be getting a headache, usually if you exercise, getting a bruise at the injection site, maybe some swelling at the injection site. Some patients feel a fullness of the forehead for a few days or a fullness of the eyelid. That's common with both of these medications. So, as you can see, either of them are very, very good choices. They both can block the muscles from moving significantly, which is what some patients want. They don't want any movement at all. And you can also give lower doses to have a little less neuromuscular blockade. So the patient will have some motion, but not full motion. One thing about Dysport that I disagree with on their advertising is they always say something not frozen. Some patients want to be frozen, and you can block to the point where there's no motion with Dysport as well. It's a dosage phenomenon. So I hope this cleared a few things up, that you understand the difference between Dysport or Botox, You could ask your provider which one they use. I personally prefer my Dysport. I would say probably 95% of my practice is Dysport. So have a great day, and I hope this was helpful.